Breaking news now. Over on Capitol Hill, just behind us here, members of the Senate are voting on the confirmation of the president's pick to be the Interior Secretary, Ryan Zinke, the congressman from Montana. That vote is happening as we speak. We are monitoring live, and we will bring you the latest as soon as we get it. Stick around right here on MSNBC. As this is happening, though, we want to talk a little bit more about Congress and its relationship with President Trump. He's kind of given some marching orders to members of Congress when it comes to repealing and replacing Obamacare. Listen.
Action is not a choice, it is a necessity. So I am calling on all Democrats and Republicans in Congress to work with us to save Americans from this imploding Obamacare disaster.
The rueful head shake from Nancy Pelosi there and some of her colleagues. Do you think they agree with the president? I think they do not at all. I want to talk about it with Congressman Ron DeSantis, Republican from Florida. And back with me here, New York Times national reporter and MSNBC contributor Yamiche Alcindor and Washington Post national political correspondent James Hohmann. Congressman, thank you for joining us. Let's talk about what House Minority Leader Nancy Pelosi had to say about the president's speech. Listen, and then I want to get your take.
Well, I was very proud of the dignity with which our members listened to a speech. It was clearly a bait-and-switch speech. The fact is that as people see what they're really presenting, because all we have is rhetoric. We don't have any reality in terms of any legislation.
So let me ask you this, Congressman. Does she have a point? Do you want to see more specifics on policy when it comes to health, President?
Well, thanks for having me on. First, let me say Ryan Zinke's a great American. I hope you'll be able to report his overwhelming confirmation. I actually thought the president hit it exactly right. He was specific enough to offer guiding principles and contours to what a replacement would look like, but he didn't get lost in the minutia, which I think would have put people to sleep. So I think his speech was very effective overall, but particularly on the health care angle, I think what he did was thread the needle where Republicans are probably going to be able to unify around those principles, particularly the fact that he linked the tax credits to health savings accounts. A lot of conservatives believe that the money's going to a health savings account. The individual can then pay their premiums tax-free and then obviously use the health savings account for other medical needs. That is one of the ways you put a downward pressure on the cost of both insurance and medical care.
But he was pretty vague on, for example, Medicaid expansion and what governors, for example, should do with that. I mean, is that a concern for you? Would you like to see some more guidance there?
Well, I think Medicaid should be used to do its intended purpose, which are people who are disabled, who are poor. With the Medicaid expansion under Obamacare, you are putting childless, able-bodied adults on Medicaid, and the problem with that is fewer and fewer physicians are willing to accept Medicaid now, so you're expanding the number of people who are trying to access care on this program. I think that ends up undermining the ability of the truly poor and indigent who we need to be helping for them to access the care that we need. And so I think giving governors the flexibility to do this makes a lot of sense. I'd also say if you're able-bodied, childless adult, there at minimum has to be a work requirement in order to receive that benefit.
Congressman, let me talk to you about infrastructure here because privately, as you know, there are some conservatives over on Capitol Hill that are concerned about how we pay for this, how much that is going to cost. How do we pay for it? He wants $1 trillion investment in infrastructure. Where does that come from?
Well, if it's an Obama $1 trillion bill, I think obviously Republicans are going to have a lot of problems with that. But what he said was he does believe there's a public component, but he's always mentioned that he wants to incentivize private investment in our infrastructure. So I think there's a lot of details that are obviously going to be important, but I'm one that definitely would like to incentivize private infrastructure development. And that's not just roads and bridges. That's dealing with our electric grid. That's dealing with pipelines and things like that. So I think the details are obviously going to be important. The higher the price tag is, the more difficult it'll be to get it through the Congress.
We heard the president again say that he inherited a mess, Congressman. But here's the reality. On day one, when he took office, the unemployment rate was below 5%. Consumer confidence was going up. The Dow was getting to 20,000. It's now, as we know, hitting 21,000. So how do you square what he said about inheriting a mess with the economic reality?
Well, I think that you look, there have been a number of people who have dropped out of the workforce. I think when he's going to these Midwestern states, people feel like they're stuck. They're not really seeing their incomes go up. The cost of just subsisting is increasing. So I think he tapped into a sense within the American people that our economic situation, it is very good for the biggest companies, and I think obviously we've seen the stock market go up, but for kind of those average folks who are just working, hardworking taxpayers, I do think millions and millions of people feel like they've been left behind. And so I think the key for him is if his policies end up clearing the way for more broad-based economic growth, people are getting into the middle class, have economic security, he's going to benefit politically for that. But I also think it's important, the mess is also international, and he did touch on that, but we clearly have a lot of problems internationally right now.
Yamiche?
Hi, I'm Yamiche. I'm a reporter with the New York Times. And what I want to ask you is, there are some members of the party, House Freedom Caucus members, who say that they're really concerned that if you tweak Obamacare, it's going to be Obamacare light, and that's not going far enough. What do you make of that, and what are your thoughts on kind of repairing the system versus replacing it totally?
Well, I think the system's architecture is flawed. It will not lead to lowering costs. Remember, that was the key promise that was made, that you'd see a $2,500 reduction in premiums for the average family. So if you're just nibbling around the edges, my concern is I don't agree with Obamacare, but I just don't think that's going to lead to putting a downward pressure on costs. It's also the case that Republicans for 6 years have said first the law wasn't going to work, then the law's not working, and that we were going to repeal it and replace it with our own patient-centered reforms. And so to the extent you're doing something that is not really living up to what you promised, I think that that runs into problems with the voters, because Republicans would not have taken the House in 2010 and they would not have taken the U.S. Senate in 2014 if they had run on just minor tweaks to Obamacare.
Congressman Ron DeSantis of Florida, thank you very much for joining us. Appreciate you being here. Yamiche, James, thank you both for joining us on